Going to be live in 3, 2, 1.
Good evening. Chair calls to order legislative session day 21-003. Council, we continue to meet with a modified agenda due to the ongoing health emergency. Please join us in standing for the pledge, followed by the opening prayer led by Councilman Woods. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all.
So yesterday I was reading some of Dr. Martin Luther King's previous speeches and some writings, and I actually ran across a prayer that he gave once. I thought it'd be good to do that today, and also it's quite timely as well. So, God, we ask you for your inspiration. Grant that we love you with all our hearts, souls, and minds, and keep our neighbors as we love ourselves, even our enemy neighbors. And we ask you, God, in these days of emotional tension, when the problems of the world are gigantic in extent and chaotic in detail, to be with us in our ongoing and our coming out, in our rising up and in our laying down, in our moments of joy and in our moments of sorrow, until the days when there shall be no more sunsets and no more dawns. Amen.
Amen. Thank you, Councilman Woods. Agenda item number 4, consideration of petitions, applications, appointments, and nominations. Executive appointments, Agricultural Preservation Advisory Board. May I have a motion?
Mr. President,
Mr. Woods.
I move to approve the reappointments of Jeffrey Ward Holloway, John Wilson Stump, and the new appointments of Jim Morris, Jacqueline Smithson, and Megan McMillan to the Agricultural Preservation Advisory Board.
Thank you, Mr. Woods. May I have a second?
Second.
Thank you, Mr. Schroeds. It's moved and seconded to approve the reappointments of Jeffrey Holloway, John Stump, and new appointments of Jim Morris, Jacqueline Smithson, and Megan McMillan. Is there any discussion? Ms. Dixon.
Mr. President,
Aye.
Mr. Johnson,
Aye.
Mr. Woods,
Aye.
Mr. Jan Giordano,
Aye.
Mr. Schroeds,
Aye.
Mr. Wagner,
Aye.
Viola.
Aye.
There being 7 votes in the affirmative and 0 in the negative, the appointments are hereby approved. Agenda item number 5, special presentations, COVID-19 update and vaccination update. Tonight, Council, we have with us Dr. Bashai, Marcy Alston, and Mr. Colin Ward. So I'd like to start with Dr. Bashai, if I may. Good evening, sir.
Yes, can you hear me?
Yes, sir.
Hi, this is Dr. Bashai, County Council President Vincenti, members of the council, and residents of Harford County. My report tonight is relatively unchanged. The COVID-19 pandemic in Harford County remains on a high plateau that it entered at the beginning of November. There's really no overall uptrend or downtrend in the community rates of transmission. Our test positivity rate is showing that 8.44% of COVID tests in the county are coming out positive as of today. And the new cases per 100,000 today is 36.74 new cases per 100,000. As I'm saying, both of these statistics have not been trending up and trending down for over 2 months in our county. Our county is just like the rest of Maryland. We're not seeing the relief we had hoped for after the holidays. Other states are seeing the relief coming. I do still have sincere hope that after all of the motion and visitation of the holidays, we will finally see some relief in the coming week. And the other good news I'll leave to Marcy Austin, who will report on the tremendous success we've had in achieving vaccine coverage in the first 3 weeks of the year. We've got 4% of county residents covered with vaccine, despite having really not having all the vaccine we'd like come in from the federal government and from the state. So I'll turn it over to Marcy now.
Good evening, Marcy.
Good evening. Thank you, Dr. Bashai, and good evening, President Vincenti and members of the Council. The Health Department now has the capacity to stand up 3 vaccination clinics simultaneously when the time comes. Vaccination clinics are running each day this week at Patterson Mill, and we have added a second clinic this Friday at the McFall Senior Center. We are ready at any given time to also use the Bel Air High School. The high schools are an ideal location for these clinics as they are large with long hallways, allowing for proper social distancing. We appreciate Harford County Public Schools for allowing us to use them. On Friday, January 15th, the Health Department received notice that we will receive 2,900 more doses, and they were delivered today. All 2,900 doses of the doses we received are accounted for. In other words, links went out to the next groups on our list over the weekend so that each appointment time for these doses is filled. We continue to advocate to the state for additional doses of vaccines. Here's our vaccine timeline for the next few weeks. This week, January 19th through the 22nd, clinics are filled with first responders and healthcare providers in priority group 1A who reached out because they missed the opportunity in the first round of 1As. The clinic this week is also filled with group 1B populations with a focus on the 75+ population, Harford County Public Schools staff, private school staff, and daycare staff. The decision was made over the weekend to stand up a second clinic at the McFall Senior Center this coming Friday, as mentioned before, to push through these 2,900 doses for the 1Bs. To date, we have sent out almost 2,000 emails with links to our 75+ population. This is a very large population of 75+ in our community, and we will continue to focus on that population. In addition, we have assessed the assisted living facilities, and we will send 2 of our nurses out to vaccinate residents in those facilities on January 27th, 28th, and 29th. We have also reached out to all the nursing homes. CVS and Walgreens are taking care of them. Once they administer the remaining second doses in early February, the nursing homes will be complete. Next week, January 25th through the 29th, we will use the remainder of the 2,900 doses by standing up a total of 7 clinics, all from 9 to 5, for the same populations in Group 1B as mentioned above, and some of Group 1A who have reached out because they missed the first round. The week of February 1st through the 5th, we will again continue with Group 1B because it encompasses a massive group of individuals and will take some time to get through. We will set up as many clinics as needed to thoroughly use the shipment we will receive next week, but we will not know how many doses that will be until Saturday. The week of February 8th through the 12th, we plan on standing up 10 clinics, that is 2 clinics running simultaneously every day that week. We have requested an additional 6,000 doses above what we might already get. We're not sure we'll get those, but we requested them. For this particular week, we will stand up a 5-day clinic at Bel Air High School specifically to complete the remainder of the HCPS staff. This will put us ahead of schedule for completing the Harford County Public Schools staff. The second clinic will be held at Patterson Mill all 5 days, where we will continue vaccinating 1B and any remaining Group 1As. To date, the Health Department has administered 3,505 vaccinations. The Harford County Health Department has shared a link with the public on our website to pre-register for their COVID vaccine. Within just a few days, we have received 18,000 pre-registrations, which I believe is just the tip of the iceberg. So you can see this is a daunting task. Our partners at HCPS have kindly offered some of their staff to assist us with the hundreds of calls we receive daily to pre-register. They began today and provided some well-deserved relief to our staff. The Health Department is receiving certain allotments of vaccine from the state each week, and so far the amount has been modest. We hope for larger shipments in the coming weeks. We are pushing the vaccine out quickly and keeping up with what we are receiving. And again, we are prepared to stand up 2 and 3 clinics a day when the need arises so that we can keep up with the allotments. In addition, the National Guard reached out to me over the weekend and is prepared to help when we get much larger shipments. We ask for everyone's patience during this process. The pre-registration will get you in the health department system, but the amount of time it takes for staff to get back to you with the link to register is absolutely reliant on the amount of vaccines we receive. Again, we continuously advocate to the state for larger weekly allotments. We also need people to remember that everyone vaccinated so far will need to receive a second dose. So we are scheduling second dose clinics as well. So you can see we are in it for the long haul. Finally, this vaccination initiative requires a colossal team effort. We have a particularly dedicated team led by Lisa Swank, working 7 days a week to make sure the vaccines are scheduled and administered as soon as possible. Kudos to that team and all the health department staff who are stepping up to help. Their years of emergency preparedness training and planning has paid off in coordinating and operating one of the county's biggest vaccination efforts of all time in the most efficient way possible, while maintaining the social distancing rules. My deepest gratitude to them. The effort cannot happen without them. And finally, I just want to thank Mr. Vincenti. He stopped by Patterson Mill today and got to take a look at our operations, and so we appreciate his coming out to that today. Thank you.
Thank you, Marcy. But listen, the congrats goes to you and your team. It was very evident today when I was there, and plus talking to several of the people that have been to the clinic, how efficient it runs, how smooth, no issues at all, and absolutely want to commend you and your team for all that you've done. And when you talk about Lisa Swank's dedication, it's no more than yours, because I know personally that you have worked through the weekend and holiday as well. So thank you for all you do.
Thank
Dr.
you.
Bashai, if I may, Marcy's report was a lot of great information, and I think we need to be a little more, productive in getting that information out into the public. You may want to make some calls to whatever venue you believe is appropriate to get that information out and let our citizens know what a job they're doing at Patterson Mill. And I also want everyone to know that we are fortunate in a way that we have 2 Dr. Bashais. I met the second Dr. Bashai today, Mr. Bashai, Dr. Bashai's wife. So she is volunteering at that clinic as well. And I want to make sure that we all know and understand and appreciate that. So council, at this time, any questions for either Dr. Bashai or Marcy? Mr. Wagner?
Two questions. Out of the local 7 counties that are closest by us, are we last in getting the vaccines out as far as the numbers of people getting vaccinated, or are we having a problem getting the amount of vaccine that we could get rid of quickly? Is that the problem? Is the supply chain?
Dr. Bashai, do you want to take
Sure,
that? Or?
I can answer that.
Okay.
So the state of Maryland has a data system that tells the counties how well they're doing by measuring the number of doses we've received, and in comparison to the number of doses received, the number we've already administered. And we are right in the middle of the pack there. Now, I don't think that's the right way to measure it, because let me tell you, we have received 2,900. We've probably given about 400 today. We have 2,500 in our freezer right now, but we have a name written on every single one of those. We know exactly who and when is going to get them. But we don't want to, it would be foolish to put them all out all tomorrow morning and crowd everybody through Patterson Mill. It's safer if we do it 400 to 500 a day, but we have a time and a place for every single one of our doses, and our performance is in the middle. The counties that do well on that, they might blow through their vaccine Monday and Tuesday and then have nothing going on Wednesday, Thursday, Friday. But we are timing out the release so that nobody is put in danger and so we don't waste any vaccine. But the bottleneck is certainly not in our department. We are flowing out in a safe and effective manner.
Okay, it wasn't a criticism at all. I was just sort of fact finding to see where we fell in that, because you guys, as we said before and tonight too, you're doing an excellent job of getting it out and vaccinating people as you are. The other second question to that was the fact that the second dose for the ones that need that second, well, all of them do, it is a different dosage than what that first vaccine that they received is, correct?
I'm not understanding.
Okay. You will have to get another shipment in of second dose vaccines.
Yes, let me explain. The state, once the state knows every first dose we've given, and they have been making sure that we get credit for every first dose, and they have set aside our second doses for us. So we are not going to run out of second doses. The state has made sure, and the federal government also, all first doses have set aside the second dose ready to come. That is the current policy. We don't know if that policy will change. I will report back if it does. But right now, all first doses have a guaranteed second dose coming, and we are still getting enough to continue giving first doses this week and next week.
Okay, great. Thank you.
And Mr. Wagner, also, it's the exact same product too, Moderna, same lot number. So you get the same shot the second time.
But it's not the same. It's not the same measure in the vaccine. It's not that. It's more, right? Correct. What I'm saying is, you couldn't hold back any of your doses that you have on hand now. There are first doses going out and give them as the second. The second dose is a different makeup in that vaccine.
That's correct. They're giving it. They label it when they tell us what we're getting as first dose and second dose. So we know which is which.
Okay.
Is that what you mean?
But I want to clarify, unless there's misunderstanding. The chemical, the actual molecule is identical, first dose and second dose.
Oh, that's my misunderstanding. I thought there was a difference in the vaccines. So the first dose is the same exact material as the second dose?
Yeah.
Oh, okay, thanks.
Yes.
Thanks for clearing that up.
Council, Mr. Johnson.
Thank you, Council President. I just have one question, just to button this vaccine up. Which members of the school community are eligible now for the vaccine? Is it staff members in the school building, students 16 and over, staff members that are in the administrative building? Who exactly is eligible right now, or is there anyone eligible right now in the school system?
So, Councilman Johnson, it's certainly all teachers, all staff who work in the school, all school bus drivers, and Marcy can elaborate on that.
Yeah, I was going to say the same thing. And this week and next, we're concentrating on the elementary school staff, and then the following. The 4th through the 8th is when we'll finish up with the middle and high school staff. So we're just trying to work through the grade levels. But we thought elementary was more important since, that's where they started back in school in the fall with the little ones. So.
Okay, thank you very much.
Mr. Giangiordano.
Yes, good evening, Dr. Bashai and Marcy. Once you get the first shot, does that mean you're safe, or do you need the second shot to be considered safe to be around people, let's say maybe in the school system and start teaching? Is it just the first shot that they'll need, or do you need the second shot to be complete?
So there is some immune protection after the first dose, but it's not considered to be enough. And the FDA's recommendation that all people who get a first dose should get a second dose according to the FDA, because only after the second dose do you get immunity that reaches up to 95%, which was what was in the trial. Nobody in the trial was left out with only a single dose. Furthermore, once you do achieve the second dose, and maybe a week or two later, you still must take precautions. You still can potentially spread disease to other people as a carrier. We don't yet have evidence whether. So you don't get to take your mask off. You never stop social distancing until we get more evidence that the interrupts transmission. Does protect people who get the vaccine from getting sick with COVID-19.
Okay, and then is there any news on the one shot from Johnson & Johnson, if that's going to be approved and when? Have you heard anything on that?
No news for me this week.
Okay, so we're still waiting for Johnson & Johnson single shot. All right, thank you, Dr. Bashai, appreciate it.
Thank you, Councilman Giangiordano. Mr. Schroeds.
Yes, actually, Dr. Bashai nailed it. My question was about wearing masks after you're vaccinated. I feel like some people probably think they have immunity, after they get their shots, so they're going to peel off the mask. And it's my understanding what you just verified, that you have to keep the mask on. I also want to encourage you to continue to get the word out via Facebook, any kind of social media, press releases, whatever you can do. I'm still fielding a lot of calls where people want to know how they're to get the vaccination. So just keep getting it out there.
Well, let me tell you some good news. So a week ago, I came on this meeting and I asked for volunteers here in Harford County. And I'm so grateful that Harford County residents came out. We had 150 plus sign up to volunteer. We've registered over 100, and 70 of them want to be our outreach committee. They will be doing phone calls. They will be posting on social media to reach out these 75 and over. So we asked, and the people of Harford County have answered. They realize that the way to get our lives back is to rely on all of us. Government and the people of the county are going to be working together to get the word out, to get the seniors registered and pre-registered to get this vaccine. I'm so thrilled to be working in a county like this. You really warm my heart. And I'm just overwhelmed with the outpouring.
Right. And I think we can all, each of us have our own Facebook pages. And maybe you have, I just haven't paid attention. I have another Northern Zone page, which has a pretty large following. And, I tried to get it out that way. And I just encourage anyone, especially those who have a lot of people that, follow them, just to share, just like what I did, with your own little paragraph with the link. And I think that may help some people out, but I think you're right. Any way that we can all help get the message out, the better. Thank you.
Anyone else? Mr. Wagner, I'm just going to speak to your comment about the vaccine and the volume and delivery. We're fully prepared, like Dr. Bashai and Marcy said. I saw it today myself. I believe that if I'm quoting correctly, Marcy, we'll be able to do 900 vaccines a day if we have the vaccines in a very short amount of time. So I think that they're doing an outstanding job. I wanted to say that again. Dr. Bashai, I do believe it's important for you to do a press release in whatever venue you believe is right to let our citizens know, like you are doing tonight, that the vaccine clinics are up and running and doing a great job. We're not sitting on any vaccines. We're not throwing any vaccines away, as been reported in other counties. So I just wanted to comment on that again. And also, as we move forward and we get more vaccines available for our county workforce, I just want to relay that County Executive Glassman has offered assistance in any way possible when the time is right and our folks are vaccinated and can help. So I just wanted to share that again. If you guys will just stand by for a minute, I'd like to bring Colin Ward up now. Colin, good evening, sir.
Hi, good evening. Thank you, Council President Vincenti and members of the County Council. And I'd like to add my compliments to the Health Department and Lisa Swank as well for a very smooth rollout of the vaccination efforts to date. Tonight, I'd like to provide an update on our vaccination efforts as well as the current state of our hospital operations. On Saturday, January 9th, we saw a second surge low of COVID positive patients at Upper Chesapeake with only 27 patients at UCMC that were COVID positive. Since that Saturday, we've seen a consistent increase in the daily volume of COVID patients that continues through today. In fact, this afternoon we have 71 COVID positive patients combined between the two hospitals. So that's approximately 2 times the amount that we cared for just 2 weeks ago. This surge is stretching our resources as we try and manage critical care beds and surgical cases, and it may result in a transfer of a COVID positive patient to another facility. We're strongly trying to avoid that where we can. But we'd like to take the moment to urge the members of the community to continue the best practices of wearing masks, practicing social distancing, and using good hand hygiene to help us flatten the curve of the second spike. With regard to the vaccination efforts, Upper Chesapeake is working diligently to vaccinate both members of our team and our physicians, as well as our community members at large. To that, we have some important updates. Thus far, we've vaccinated more than 4,100 people, I should say, including team members, members of the medical community, and first responders. And this week, we began to implement our efforts to augment the health department vaccination program by starting clinics for patients in the 1B category, both at Harford Memorial Hospital and Upper Chesapeake Medical Center. Eligible patients must complete a form that can be found on umms.org/UCH. There's a COVID link right on the front of that screen, and you can fill out the important information. Our team will verify that you meet the criteria and will send you an invitation to schedule your appointment. A couple of important items for scheduling is that patients must bring a photo ID at the time of the vaccination. These are important considerations as well. Patients should not arrive more than 15 minutes before your scheduled time. We want to assure the people that have signed up that we have the dose for them. So arriving early, it won't actually help you ensure that you get the dose. If you've signed up, you're verified, you will receive the dose. So we want to stress that so that we can keep social distancing in place as people queue up to get the vaccine. We also encourage people to wear a short sleeve shirt or garment underneath their coat so we can easily access your arm for the injection site, and this is what helps keep the operation smooth, as I'm sure my health department colleagues can attest. After you receive your dose, our team will help you schedule your appointment for the booster shot, which, depending on the vaccine, either Pfizer or Moderna, will be 21 days for Pfizer or 28 days for Moderna. And you will be observed for 15 to 30 minutes to ensure that you don't have any adverse reactions. And want to assure the public that at this time, we've had very limited need for extended observations. Most people just experience some slight discomfort at the injection site, similar to the way that you would receive a flu shot. Where possible, we will add new clinic times and dates to help vaccinate as many patients as we can. And we will be adding a clinic this Saturday at Upper Chesapeake Medical Center, in addition to the daily clinics that we've been running at Upper Chesapeake and at Harford Memorial this week. So on Saturday, January 23rd at UCMC, we will run an additional clinic from 9 a.m. to 3 p.m. using the same registration process that I just outlined. It's absolutely vital, and this is really important for everyone to think about this. If you schedule an appointment, it's important for you to keep it. And this will help us prevent having to open a vial of vaccine and then not have enough patients to put the vaccine into. And this practice is called wasting. So if each vial contains 10 doses and we only have 9 people ready to receive it, we have to waste that 10th dose. And fortunately, we have not, in the course of administering more than 4,100 vaccines, had to waste a dose because we didn't have a person interested in getting it. But it is key as you sign up, whether it's through the health department or through Upper Chesapeake, that you keep that appointment if you make it. This week, we also, actually starting today, we've begun to vaccinate hospitalized patients that meet the criteria for 1B, and this would include those age 75 or greater, or that have certain comorbidities that may make them vulnerable. All patients that meet the criteria will be offered the vaccination if they choose. And so as the state migrates to different groups, 1C, we will adjust our targeted program as well. So example, when we get to 1C, we will expand our offering to those 65 or greater, and so on. Finally, Upper Chesapeake is preparing for the ability to offer monoclonal antibody infusions. For the right patient population, this medication has shown great promise in slowing the progression of COVID and potentially preventing admissions to the hospital. This therapy is currently offered in just 7 locations across the state, with the nearest location at the Baltimore Convention Center. We're working with the University of Maryland Medical System and the state of Maryland to be able to offer this medication at UCMC in the near future, and we'll update you as soon as we have approvals. And keeping with Marcy Austin, I too would like to echo praise for our vaccination team, Vicki Benz, who has been quite a potent force here in the community, as well as Karen Goodison and Angela Cadis to help us keep track of all the vaccination efforts. It's been great to see the team work across the continuum of care. At this point, I'd be happy to answer any questions that you may have.
Thank you, Connor. Excuse, or Colin, I'm sorry. Council members? Any questions for Colin? Colin, thank you for the update. Thank you for all your efforts. Please give my congrats to Vicki as well, and thanks. Dr. Bashai, Marcy, I'm sure we'll be talking again tomorrow. Thank you for your updates this evening. Be well.
Thank you.
Thank you. Good night.
Agenda item number 6, approval of minutes. 2021 State of the County and Legislative Address, January 12th, 2021. Legislative Day 21-002, January 12th, 2021. Are there any corrections to the minutes? There being no corrections, the minutes stand approved. Agenda item number 7, introduction and consideration of resolutions. Mr. Vice President, please read in Resolution 002-21.
Thank you, Mr. President. Resolution 002-21, Historic Landmark, Clark's Chapel Methodist Episcopal Church. Introduced by Council President Vincenti at the request of the County Executive. A resolution designating Clark's Chapel Methodist Episcopal Church, consisting of 5.79 acres, located at 2001 Camilla Road in Bel Air, Maryland, together with its buildings, environmental settings, appurtenances as a Harford County historic landmark in accordance with Chapter 267 of the Harford County Code.
Thank you, Mr. Woods. Council, I'd like to welcome Jenny Jerkowski. Yep. Jenny, can you mute your phone or your computer or whatever you're watching?
I will.
Okay, thank you.
I'm here.
Yep, thank you, and welcome.
Thank you. Good evening, Council President Vincenti and members of the council.
Let's get feedback. That'll be something else.
My name is Jenny Jarkowski. I'm going to get out of this completely.
Thank you. Sam,
is the PowerPoint up?
So Jenny, the PowerPoint is up, but we're getting a tremendous amount of feedback for some reason.
Okay, let's try this again. I'm completely off of my computer. So good evening, Council President Vincenti and members of the council. My name is Jenny Jarkowski, Director of the Department of Planning and Zoning. With me tonight is Jacob Benson, Historic Preservation Planner, and we are pleased to be before you tonight with Resolution 002-21 for the Harford County Landmark Designation of Clark's Chapel Methodist Episcopal Church. Next slide, please. The designation of a Harford County Historic Landmark is part of Chapter 267 of the Zoning Code. The preservation of sites, structures, and districts of historical, cultural, archaeological, or architectural significance preserve and enhance the quality of life in Harford County by safeguarding the county's historic and cultural heritage, strengthening the local economy, stabilizing and improving property values, and fostering civic pride in the beauty and accomplishments of the past. The process of designation of a county historic landmark begins with a nomination detailing the cultural or architectural significance of the property. The property owner must give consent in order to move forward with a county historic landmark designation. A public meeting is then held, allowing the Historic Preservation Commission to review the application and vote on whether to recommend landmark designation for the property. Next slide, please. The designation of obtaining landmark designation include protection of the landmark property from demolition or inappropriate alteration, buffer protection from development of adjacent properties, and eligibility for Harford County Historic Preservation tax credits. After the landmark designation is completed, the Historic Preservation Commission works with the owner to ensure future exterior alterations are appropriate, and the Historic Preservation Commission approval is also required for projects applying for the Harford County Historic Preservation tax credit to ensure the work is completed in accordance with the historic preservation best practices. Next slide, please. The resolution before you tonight is for Clark's Chapel Methodist Episcopal Church located at 2001 Calmia Road near Bel Air. Mr. Curtis White and Mr. William Brown, representing the church's Board of Trustees, are in support of the nomination. Clark's Chapel Methodist Episcopal Church is one of the oldest traditionally African American churches in Harford County. The property was acquired by the congregation in 1855 and served as a community and religious meeting place for many years before. The historic church building on the property was built between 1883 and 1885, replacing an earlier building noted on the historic map. Alterations and additions made to the building on the 20th century reflect its continuous use and the changing needs of the congregation and the community. The congregation, now known as Clark's United Methodist Church, continues to use the property for religious services and community events. In addition to the historic church building, the property contains a historic graveyard containing both marked and unmarked burials dating from the 19th, 20th, and 21st centuries. Clark's Chapel Methodist Episcopal Church embodies character, interest, or value as part of the heritage and culture of Harford County, and has both yielded and shown the potential to yield important information about the history of Harford County and its people. At their November 4th, 2020 public meeting, the Historic Preservation Commission recommended the property for designation as a Harford County Historic Landmark. Mr. Benson and I would be happy to answer any questions that you may have. Thank you very much.
Thank you, Jenny, and sorry for the issues here. So,
no worries.
So I took the time to visit the church today, actually, while I was coming into Bel Air, and had the opportunity to go by and check it out. It looks like the building in front is in need of some help. I'm hoping that this designation would help them maybe raise some money for grants through grant process.
It's possible, although they are institutional use, that may be somewhat of a challenge, but we are always willing to work with people and figure out ways to help them.
And the building in the back beyond the pavilion, is that a new church?
I will have to ask Mr. Benson to chime in on that.
Mr. Benson?
Yes, Mr. President, in answer to your question, the building to the rear of the historic building is the modern church building, which was built in the 2000s.
Yep, very well maintained, I must add. Council, at this time, any questions? Mr. Schroeder?
Yes, just want to thank you and the board for bringing this forward. I do kind of think that it's very timely also with Martin Luther King Day that we're preserving some heritage here for the community. So, with that, kudos to all of you, and hopefully, I guess it is more complicated, Jenny. I know that maybe my colleagues might not understand the institutional use part, but I guess it's because of they're already not paying the taxes that we would as private individuals, so it's harder for them to get those tax credits. Is that?
That is correct, Chad.
Okay. Is that something that could be changed locally since this is a local landmark? I realize that there's other designations, through the, nationally and through the state. I'm just wondering if there may be, grants through Preservation Maryland, which is more of a private nonprofit, or if with the local tax credit, I wonder if there's a way that we could develop, enhance the current credit to allow for a use like this to receive a credit.
Yes, there are ways that we could possibly explore for sure.
Okay, very good. Well, maybe that's something we can all, look, try to make happen. I think that would be wonderful. A lot of, especially now with COVID, a lot of nonprofits and other institutional uses, they're struggling right now, just like many businesses and individuals. So, I think that would be wonderful if we could work on something like that.
Agreed.
Thank you, Jenny. Thanks for the
Thank you.
presentation.
Thank you.
Thank you, Mr. Schroeder. Anyone else, council? All right, seeing no one else. Jenny, Jacob, want to thank you for your presentation.
Thank you, Mr. Vincenti.
So, Mr. Woods, please read in resolution 003-21 and 004-21.
Thank you,
Record for introduction, please.
Thank you, Mr. President. Resolution 003-21, MEDAAF loan and WFTTG Project Dane. Introduced by Council President Vincenti at the request of the County Executive and Councilmember Bueller. A resolution endorsing a loan in the amount of $750,000 from the Maryland Department of Commerce, the department, to Project Dane or an entity acceptable to the department. The loan, pursuant to the Maryland Economic Development Assistance Fund, Section 5-301 through 5-349 of the Economic Development Article of the Annotated Code of Maryland, to assist Project Dane with the following: facility core and shell expansion, tenant improvements, and material handling equipment of its proposed leased warehouse distribution facility currently located at 1500 Woodley Road in Aberdeen, Maryland 21001, the project site, and the purchase of furniture, fixtures, and equipment and IT for the existing facility, and authorizing a workplace training grant in the amount not to exceed $75,000 over a 3-year period from Harford County, Maryland, to assist Project Dane with employee training at the project site. Introduced, read first time, order posted, and public hearing is scheduled for Tuesday, February 16th, 2021 at 7 o'clock p.m. virtually. Resolution 004-21, waiver of distance restrictions, introduced by Council President Vincenti and Council Member Johnson. The resolution recommending that the Harford County Liquor Board approve the request by 418 Constant Friendship LLC for a waiver of its 300-foot general restriction from a place of worship for the issuance of an alcohol beverage license for its proposed restaurant. Introduced, read First time order posted, and a public hearing is scheduled for Tuesday, February 16th, 2021 at 7:00 p.m. virtually.
Thank you, Mr. Woods. Agenda item number 9, business from the president. I remember early on in my first term on the council, in just days, Councilman Schroeds made a comment to me and said, one thing you need to know that this is a 24/7 position. And it's never been any more evident than now going through this current pandemic. So this past weekend, among the calls in reference to vaccines, the pandemic itself, I also had several conversations with our coaches and family members in reference to the ACPR gymnastics program in Churchville. And I want to thank Steve Corneliuson for reaching out, making me aware of their issue there, and talking to several of the parents. These folks have children in those programs that are level 10 gymnastics people. They participate on the USA Olympic competitive gymnastics team. They are some of the best that we have in the program. So it was very interesting to listen to them and catch up with them and some of the challenges that they're facing throughout the pandemic. And I believe we will hear from some of the folks and parents involved. I did receive a very nice video today from Ms. Hernandez, and I forwarded on to the county executive and had several conversations with not only the county executive, but other members of the administration and the health department. So we'll try to do the best we can to kind of navigate through some of those issues. And again, we all have to realize that it is based on the metrics that we're seeing with the pandemic. So rest assured, we're listening. This past week, I had the opportunity to meet with the entire environmental team at the health department via WebEx. And I want to thank John Resline for putting that together for us, and also Dr. Bashai and Ms. Austin. We had an opportunity to talk about many things, but one of the most important things was customer service. And I explained to them, and they understand this, but for many of our citizens, this is the first time that they ever have an opportunity to interact with county government is through a permitting process. So I just wanted to express the importance of the relationship that they receive when they're first encountered with our citizens. So it was a very good meeting. I wanted to thank them all for their efforts throughout the pandemic thus far. And then again, we talked earlier about visiting the clinic, the vaccine clinic today at Patterson Mill. And again, they've done an outstanding job there, fulfilling their obligations there. So I want to thank all of them again. And then finally, Jeannie and I wish to express our deepest condolences to the Rigdon family due to the passing of their father, George. I believe he was 97. We would ask you to keep John, Andy, and the Rigdon family and friends in your thoughts and prayers. And with that, Mr. Johnson.
Thank you, Council President. I don't have much to say. I know that it's we're celebrating Dr. King, and and thank you, Vice President Woods for that elegant prayer tonight. I was looking at Dr. King earlier this week, and he had a right before his assassination, him and Harry Belafonte were talking, and Harry Belafonte looked over at Dr. King and said, what's wrong, Dr. King? Why you look melancholy? Those were his words. And Dr. King said that he feared that he was integrating his people into a burning house because of the state of the nation at that time, the civil unrest of the nation at that time. And he said to Harry Belafonte that they needed to be firemen to put the fire out. And that resonated with me because the state of the nation right now is in flux. And I think, and I'm not speaking to the folks out there that are listening to this broadcast. Who I'm speaking to is us as elected officials. And I think that those words that Dr. King said some 60 some odd years ago apply to us, that the house is burning and that we need to be firemen and put the fire out. We can be we can disagree on things, whether it's from the right or from the left, but we don't have to be disagreeable. We can people charge us to not to give them the facts and not give them alternate facts or what have you. So I think that that we as elected officials, because believe it or not, politicians have a worse they folks look at us as some of the most I hate to say, but pariahs or bottom feeder, whatever they want to call us. But the fact of the matter is that we are elected to give people the truth and the facts, to be straight shooters down the middle. I believe in my counterparts on this council that we give people the facts, but as a whole, for our community and for the elected officials that we congregate with, that we need to start pushing this message out to all elected officials, everybody that's in public service, to tell everyone that we need to stop this rhetoric, that we need to give people the facts, nothing but the facts, be straight shooters with people, so that even though it may hurt, they understand that the facts are the facts. But I want to thank this council for really being diligent, really being committed to the folks of this county, and encourage us to just keep moving forward. So with that, I'll yield my time back.
Thank you, Mr. Johnson. Mr. Woods.
Thank you, Mr. President. Tomorrow, of course, is another legislative day in Annapolis. We have 60 some bills to go over. My committee has at least 12 of them, which are all dealing with taxes and taxation. It doesn't seem like too many things through our committee are passing that deal with any type of tax increase, but it still has to go to the legislature next. So things that are getting through our committee are a lot of the tax or the income tax exemptions and modifications, subtractions, things of that nature. I think it seems like the local county electeds and the councils and commissioners from the counties want to see more of more tax exemptions and subtraction modifications going in, especially to help deal with the pandemic issues and people who are not don't have the money. So hopefully the state legislature feels the same way, and we get a lot of these taken care of. So with that, it's going to be an early morning tomorrow, and I think we're going to have a long day in Annapolis, but we'll give you guys an update afterwards. So thank you.
Thank you, Mr. Woods. Mr. Giangiordano.
Thank you, Council President. I want to wish my condolences to a high school friend that I played football with. Mr. Paul Betzel passed away a few weeks ago, and also a young lady by the name of Deanna Alick, who unfortunately passed away in an accident down in Perry Hall, where a car ran through Crab Place where she was working. Condolences out to her family. I want to say happy birthday to Martin Luther King, and just remember that treat people how you want them to treat you. You need to treat them the same way. So you don't know, can't read a book by its cover. Don't assume. You never know anybody. So if you're nice to them, hopefully they'll be nice back to you. I think that means a big thing, no matter what you do and how you do it. Thank you, Mr. President.
Thank you, Mr. Giangiordano, for those words. Mr. Schroeds.
Thank you, Council President. I just want to express my condolences to several Lions Club members who, to their families who had recently passed. One is Marty Green, good friend of mine, has done great things for our community from Jarrettsville. And, we're just going to miss him so much. Also, George Rigdon, he's our eldest Jarrettsville Lions Club member. And, he was my buddy. I always sat next to him when we were eating and just enjoyed his company. Used to sit with him and Hap Smith, the older guys. And just keep Ben and John and the entire Rigdon family in your prayers. We're really going to miss him. Also this morning, my good friend Kim Rutledge passed away, the wife of Jim Rutledge. You may know him, attorney in town. I just couldn't believe it, because the last I heard, she was doing really well with the cancer she was fighting, and just incredibly shocked to learn this afternoon. So please keep Jim and Ashley, her daughter, and Forrest, her son, in your prayers. I know it's going to be really difficult. Just such a beautiful lady. I also got to know her mother, Miss Santa, really well, and I really just can't believe it. Sorry, but sadly, one of my good friends and classmates from North Hartford, Brian Indy, he's nearing the end of his life, if he hasn't already passed. Just a really good friend. I've known him since 8th grade. Remained in pretty good contact since then. He encouraged me to try out for lacrosse. We even, our bond even became stronger through the sport. He was our goalie and I was a defender. Then he did serve his community at the Jarrettsville Volunteer Fire Company. So, he maintained playing lacrosse, but that did take a lot of his time, and I always commended him, for serving his community in that capacity. From there in his career, he went and worked his way up through the American Heart Association. Used to always see him at all the blood drives, and he did tremendously well for that organization, and he continued to save lives doing that, which he was so passionate about. He married his wife, Kim. They have 2 daughters, 12 and 17 years old. And he was very close to his sister, Christine, and his mom as well. He had lost his father at an earlier age, like I did. But just please keep Brian in your thoughts and prayers. He was a great guy. I'm going to miss him. I'm sorry to just have condolences to read tonight, but it just kind of, sometimes we just have that, and it's just incredibly sad, and life is precious. We don't know, what's going to happen tomorrow. I can't help but think of some of these, not all of them, but, they didn't have an opportunity in many cases to say their goodbyes. And a lot of people are struggling with that because of COVID. You can't go visit people at hospitals anymore. You can't go see them in a nursing home oftentimes. You can't, it's just really difficult. I sure hope we get through this soon, and that these vaccines get out in our community, and, we can get back to normal. So thank you for having me.
Thank you, Mr. Schroeds. Mr. Wagner.
Thank you. earlier today and from time to time, council members do have conversations with the superintendent of schools here in Hartford County to discuss, sort of where they are, where they're headed, what they're doing, and that sort of thing. And today, I know some others had a meeting with him as well virtually, and Councilman Johnson and I joined with Dr. Bolson to have that conversation today. And it was a worthwhile hours worth of meeting to discuss their plans for the future budget and what they're doing right now. Council President Vincenti mentioned the ACPR program there in Churchville, which is in my district, and I'm very familiar with it. In my first term, I think is when a lot of that came into existence, a little bit different than what it was in the years before. And in fact, I've got a copy of the petition that the ACPR group is circulating presently. There's about 800 plus signatures on the one I have. And some of those are in county, some are out of county, some are out of state. But I guess for my fellow council members and those that may not know, the building that houses the program, which is a very worthwhile program, and I'm not going to say anything bad about it because it does serve a great purpose. And, much like some other athletic programs we have out there for some of our youth that, generate scholarships and things like that. The building itself that it's housed in, Hartford County does own, and Hartford County allows them to use it. And in some of the comments I saw from some of the individuals that wanted it reopened, they made statements as though it was their building and their obligation, and that's not exactly right, because Hartford County does have it under their guise, and that's what the problem is that it's not a private gymnasium, and that when County Executive Glassman says that we're closing all the county buildings to the public, this one falls in that category, much like the tennis barn or some of the other buildings that we have out there. The other building there at Glenville too, there on 155 is also closed to the public. So we're not having any public enter county buildings at this time, and that's where this one fell into that crevice. And it's unfortunate for the girls that do need the practice and do need the place opened up. But you start cherry picking and start opening up one building here and one building there, then you're on your way to opening up everything prematurely of what maybe the health department would recommend for us to do. So just to preface what you may hear later this evening or what emails you've already gotten, I know you're getting more in the future. So keep me in the loop with you guys, what you hear, and I'll certainly keep you in the loop too. Thank you, guys.
Thank you, Mr. Wagner. Mr. Beulah.
Thank you, Council President. Just a few comments tonight. Yesterday, in commemoration of Dr. Martin Luther King Day, I personally spent some time praying for our country and our leaders, and I would ask all those in attendance, those prayer warriors out there, to do the same. We need to pray for our country and our leaders at the national level, at the state level, and at the local level. I also had the pleasure of attending one virtual event and viewing another presentation. The first was the virtual event, and it was titled Deeds of Faith for Civil Rights, sponsored by the Unitarian Universalist Church in Bel Air. It was prepared and narrated by Marla Posey Moss. Marla did an outstanding job, in my opinion, with the presentation, and the contributions by members of the faith-based community was most excellent. Job well done, Marla. The second was an NAACP presentation in collaboration with the Hartford County government, entitled A Tribute to Coretta Scott King, the wife of Dr. Martin Luther King Jr. It was narrated by Jim Thornton, featured an interview with Coretta Scott King, and many fine tributes by Hartford County residents, given in word, song, and dance to celebrate her life and community service in continuing the legacy of her husband, Dr. Martin Luther King. Both of these I thoroughly enjoyed, and I would say if you get a chance to go and look at these, I think I know both of them. I know the presentation by the NAACP and the county was recorded. Go look at them. I thought it was most excellent and just well done. I also want to thank Pete Panos, the administrator of Citizen Care Nursing Home in Havre de Grace, and all the staff for the amazing job that they're doing during this pandemic. And just to let you know, Citizens Care has 13 departments, 204 employees, and at this time, 104 residents. 96% of the residents have received their vaccinations and 53% of the staff. The next vaccination clinic is scheduled for January 28th. Through the case rate was extremely low. We've seen an uptick in a couple of areas recently in the last couple of weeks, but as of today, and I spoke with Pete Panos today, no residents or staff member has died of COVID-related illness. And with that, Mr. President, thank you.
Thank you, Mr. Beulah. Agenda number 11, comments and input from citizens. Ms. Dixon, do we have anyone signed up?
Yes, Mr. President, we have 19 this evening.
All right, so with that, before we get started, I just want to remind everyone of our 3-minute time allotment and would ask you to be precise and move on. First caller is Suzanne Singleton.
Hello.
Good evening. It's Council President Vincenti. May I have your name and address for the record, please?
Yes, good evening. My name is Susie Singleton. My address is 219 Thunder Gulch Circle in Havre de Grace.
Thank you, ma'am.
Yes,
Go ahead, ma'am.
Yes, this evening I'd like to speak to you about my request to reopen ACPR gymnastics at the Churchville Recreation Center. My 8-year-old daughter, Alyssa, has been competitively training at ACPR for the past 2 years. ACPR was closed due to COVID-19 from March to June, and they reopened from July through November 13th. Prior to being closed in November, ACPR had no cases of coronavirus and followed all safety protocols for both gymnasts and parents. ACPR is the only gymnastics program in the entire state of Maryland that is closed. That includes all other counties that have competitive team gymnastics that are associated with rec programs. They all remain open. I'd like to share with you 3 key points about why ACPR should be reopened. Number 1, gymnastics is a sport that can follow all COVID-19 guidelines. So unlike many other rec sports, gymnastics requires no physical contact. There's one gymnast on the equipment at a time. In this respect, I would compare gymnastics to sports like tennis and golf, except we use specialized equipment that must remain inside. The rec center is very large with 2 main gyms allowing for social distancing. There's also many doors throughout the facility which can be opened to allow fresh air to circulate. The coaches have strict cleaning regimen, and again, ACPR had no instances of COVID during the period they were open. Point number 2, gymnastics is a sport that requires continuous training and conditioning. Under normal conditions, the girls train for 10 to 20 hours per week. Since the rec center has been closed, practices have been reduced to 2 hours per week via Zoom. There are significant limitations with being able to practice at home due to lack of equipment and safety. These girls have been practicing for years, and their hard work can easily cause setbacks in a short period of time. ACPR has rented space from other cheer and gymnastics facilities in Baltimore and Howard counties. I take Alyssa to a cheer facility which has no gymnastics equipment for practice 1 day per week. However, this creates additional strain on our family, as I'll talk about in my third and final point, the impact on ACPR families. As I mentioned, I drive Alyssa to this cheer gym on Tuesdays from 4 to 6 p.m. I work full-time, and I'm a single mom of Alyssa and her younger brother. So I'm spending 2+ hours driving to and from practice, which puts us at an increased risk of traveling on 95 and traveling to another county with higher COVID cases. You may be thinking I have a choice, right? She doesn't have to participate in this practice. Well, parents are under a lot of extra stress right now. We're trying to keep life as normal as possible for our kids while doing it safely. Alyssa loves gymnastics and it makes her happy. It keeps her strong both physically and mentally.
Please bring your comments to a close.
Okay, in closing, I believe the county can take action to reopen programs that can benefit our kids. There's very minimal risk with gymnastics. And again, during the 5 months that ACPR was open, there were no cases of COVID.
Thank you, ma'am.
I thank you for your time and service to our community.
Thank you. Mr. Malamo?
Milano.
Good evening, sir. It's Council President Vincenti. May I have your name and address for the record, sir?
Sir, good evening to you and your colleagues. John P. Milano, 2402 Eagle View Drive, Bel Air, Maryland. It appears that from last week's meeting, there is general agreement that schools should reopen. There does not appear to be a decision process for that event. I would share these thoughts on a way forward. First, Dr. Bolson and the Board of Education should be indemnified against criminal and financial liability. I spell INDEMNIFIED. I would not fault Dr. Bolson for keeping schools closed if he is faced with criminal or financial penalties as a result of opening them. Removing the threat of liabilities may be incentive to open and reducing associated risk. Perhaps you could get all the appropriate legal people together to resolve that issue. Next, we should reframe the question from when should the schools open to is it safe to open? At present, Dr. Bolson is waiting for the state's mandated 5% positivity rate metric to open schools. He has aligned himself with our good governor, both awaiting for a sign. Much like ancients who relied upon astrologists, necromancers, and other assorted mystics to predict the outcome of a situation by examining the position of the stars or the entrails of a chicken. What science supports a 5% positivity rate metric for opening schools? I would submit that that sign is unlikely. As Dr. Bashai pointed out, the data is highly variable. Additionally, looking at the state's data we see, very few are recovering. There are no results for more than half the tests administered. The number of tests administered exceeds the population. There's no way to correlate test results with the day they were taken and patient intake over time. There may be a seasonal impact. Finally, the error in test results is unknown. I would submit that with all that, there could easily be a 50% error in the results. The data set used for that metric is absolutely worthless. To determine whether the condition is safe, we should clean up the data set and change the criteria. Analyze the number of negative test results, the number of people recovered, the hospital bed capacity, and effectiveness of treatment. When we see that negative test results are rising, the recovery numbers are rising, hospital bed capacity is adequate, and effective patient treatments are available, it is time to open the schools. These are my suggestions, greatly simplified, no doubt. I would be interested in hearing yours. I understand that you are not responsible for schools, but just as in chemistry, sometimes it takes a catalyst to start and accelerate the process. On a final note, over the past few years, I've been told by the media and elected officials that our president is a liar, a scoundrel, a rascal, a recidivist reprobate. Not believable. I have been told by the media and various elected officials that other media venues and elected officials opposing political thought are no better. Tomorrow, we will have a new president. We will be left with the same media, some of the same officials, and you. Why should I believe any statement from him, from them, or from you? A thought to ponder for all of us. Good night.
Good night, sir. Stephen Hill.
This is Steve.
Good evening, sir. It's Council President Vincenti. May I have your name and address for the record, please?
Yes, sir. Stephen Hill, 1411 Emily Court West, Abingdon, Maryland.
Thank you, sir.
Thank you, County President Vincenti and members of the council. I really appreciate your time, attention, and consideration tonight. My name is Stephen Hill. My daughter Anna is a level 10 gymnast at ACPR. She's been competing in the sport since she was 6 years old and will complete her club career here at ACPR this year as a senior. She continues to work toward her goal of competing in Division I program in college and is in active recruitment discussions with about a half a dozen D1 coaches in schools. To maintain both fitness and skill levels in this sport, she typically trains 20 to 25 hours a week in the gym. With our gym closed, the only USA Gymnastics gym in the state of Maryland closed at present, she's currently driving 4 times a week to a gym in Elkridge about 45 minutes each way that's been generous enough to allow her to train there. And while I marvel at her tenacity, I do not understand why her gym in Churchville remains closed while all these other gyms have been able to remain open. We are the exception here, and unfortunately our girls are paying the price simply because of where their gym is located and the decisions some have made without considering all the facts and, quite frankly, adopting a one-size-fits-all solution. And let's consider the facts. Coach Steve and the staff have been conducting practice in a safe and compliant manner for months in accordance with all the regulations and guidelines. We typically had no more than 40 girls at a time spread out across 20,000 square feet of gym space, a per user density much lower than most facilities. And most importantly, let's look at the outcomes. As others have mentioned, there's not been any community spread facilitated through the gym's operation. Much has been made throughout this pandemic and the mental health consequences of virtual schooling. I would tell you, this set of circumstances has both mental and physical health impacts. These young ladies are tremendous athletes, typically very strong students as well. You see the work ethic and perseverance, among many other life lessons they learn in this very demanding sport, serve them well in all aspects of their lives. Their sport is not one you can simply take outside or do at home, at least not safely and responsibly. And as you can imagine, they develop quite a bit of their identity through this sport as well. So not being able to be in the gym, doing what they love, has impacts too wide to ignore. They deserve to be able to train with their teammates and friends on familiar equipment under the supervision of their coaches. Please don't allow this current decision to stand. Help us pick up this cause and influence the changes we need to get our daughters back in the gym. Appreciate your advocacy and support.
Thank you, sir. Amy Cox.
Hello, this is Amy.
Good evening, ma'am. May I have your name and address for the record, please? This is Council President Vincenti.
Yep, Amy Cox, 1318 Vanderbilt Road, Bel Air, Maryland. And then my daughter Cheyenne Cox will be speaking on behalf of the ACPR gymnast.
Only one of you can speak, ma'am.
Yes, my daughter Cheyenne will be.
Thank you.
Hi, this is Cheyenne Cox from ACPR Gymnastics. I'm an expelled gymnast and have been practicing at least 6 to 8 hours a week for the past 5 years. Our gym was closed from March to June of 2020 and reopened from July through November 2020, only to be shut down again. During the time we were open, we followed all CDC guidelines and had 0 cases. We are the only gymnastics team, public or private, in the state that is currently closed, with no date of reopening in sight. For the last few months, we have been traveling to other gyms and putting additional stress on us and our families as we try to prepare for a competition season. As we have been traveling to other gyms, ACPR by far has the best equipment and space to accommodate social distancing. To ensure that we are following CDC guidelines, we wear our masks in the gym, we have our own equipment bags, and wipe down the equipment between each rotation. Also, when we are on the floor, we have our own designated space to stretch. Gymnastics is not a sport where you can jump back into this and put us at this puts us at a huge disadvantage. As it takes years of training to build up our skills, gymnastics is one of the best ways to develop training overall health and wellness. It takes hours of training, conditioning, strength, repetition, discipline, determination, improves sleep, and helps fight depression. Gymnastics has been a huge part of my entire life and keeps me grounded and healthy. I miss doing gymnastics in my gym, and I miss my coaches and being able to see my friends. We are committed to being safe during this pandemic and following all required protocols. We have already shown that we can do this successfully, and we would be much safer training in our own gym. We should not be the only facility in the state of Maryland that remains closed. Thank you for your consideration.
Thank you, Cheyenne, for your comments. Ms. Hooker, Catherine Hooker.
Hello.
Good evening, ma'am. It's Council President Vincenti. May I have your name and address for the record, please?
Hi, Catherine Hooker, 119 Lapidum Road, Happy Grace, Maryland.
Thank you, ma'am. Continue.
Thank you for letting me speak tonight. My position is to reopen ACPR gymnastics. In regards to reopening ACPR, we have learned so much in the last 10 months that the response mandates, such as the November 13th pandemic response to shut down all Parks and Rec buildings, needs to be revisited and revised to fit the current information available. In regards to the snowball effect that could occur from opening only ACPR building, please remember this building houses and it is equipped for only one sport, one specialized sport. You cannot go outside and play gymnastics like other sports such as soccer, basketball, and baseball, which I believe is housed in the 155 Glenville building. Specialized equipment is required for gymnastics, which is not easily accessible at other facilities. There is no effective Zoom class for gymnastics. We are working hard to show you we can keep ACPR safe. If you review the CDC's guidance consideration for youth sports, there are 11 criteria used to address the risks associated with opening youth sports. Most of the criteria deals with how close participants and coaches are to each other during the event, and if they can safely socially distance when not engaged in activity. While gymnastics is a team sport, much of the activity is individual based, as only one person can be on the equipment at a time. Gymnasts are able to socially distance while participating due to the limitations of the equipment. Gymnastics is an indoor sport. However, the Parks and Rec building used by ACPR includes 2 large gymnastic centers, allowing for more space between participants. The gymnasts have their own gear, water bottle, chalk, tape, etc. But the equipment is shared. ACPR has developed and maintained strict protocols for cleaning equipment between uses that can be reviewed by the Parks and Rec Committee at any time. ACPR team gymnasts are also categorized by level, keeping the size of each group significantly low that practices and competes on different days and times. One of the final criteria in regards to non-essential visitors, spectators, and volunteers. This is the parents. While we hate it, we are willing to not enter the building and not watch our children participate as previously set by ACPR protocols, as long as our gymnasts are able to participate. I challenge the Council and Parks and Recs Committee to do a risk assessment based on the CDC's guidance to open ACPR. I would like to thank you again for the opportunity to speak tonight.
Thank you, ma'am. Tricia Payne.
Hello, Tricia speaking.
Good evening, ma'am. It's Council President Vincenti. May I have your name and address for the record, please?
Yes, sir. My name is Tricia Payne, and my address is 3800 Rush Road, Jarrettsville, Maryland, 21084.
Thank you, ma'am. You can continue.
Okay, thank you. Good evening, council members. My name is Tricia Payne. My daughter, Caroline, age 11, joined the ACPR team program in July 2019 after being turned away by another local private team because she was too old. Not only did ACPR embrace Caroline, they challenged her, helped her accelerate her skills, and with the support of these great coaches, she was able to grow to a level 4 gymnast in 12 short months. Our girls are not getting any younger. They are now being placed at a disadvantage compared to other teams, which hinders their athletic growth, ability to compete, and eventually their scholarship opportunities. It isn't even about switching gyms. It's not as easy. Plus, by doing so, it'll crush this great program that has been in place and served this county for more than 40 years. As such, we started a petition, and in a few short days, we have now reached 907 signees that support the stance to reopen the gym. In that light, let me share with you some of the comments. First, ACPR parent Jennifer Kelly. These gymnasts have been training since they were young children, putting in 4 to 20 hours per week of dedication. It takes hard work, determination, and a love of the sport to spend this many hours in the gym. To take this away, especially for a competitive gym, is not acceptable. This is not a rec sport. It cannot be compared to other rec sports. We are the only competitive gym in Maryland currently closed. Our gymnasts deserve to have their home away from home reopened. Another Harford County resident, Robert Gruchowski, said the county executive's rationale in this matter is understandable. However, its application and therefore its effectiveness is actually very limited. Other gymnastics programs, as well as indoor soccer and baseball facilities and gyms across the county, continue to operate. By keeping ACPR closed, the county is depriving these gymnasts of an outlet to mitigate stress. The staff has proven they are able to run a safe program. Please allow them to continue to do so. ACPR coach Vicki Evans writes, please open Churchville Parks and Recs. We were open and had no problems, no COVID in our group. We practiced very stringent sanitization protocols during all practices. Another gymnastics coach, Tracy Lynn Denny, writes, I am a coach at Thrive Gymnastics in Anne Arundel County. I have been coaching now for 29 years. Since we've been open, we have had 0 cases of COVID. Our kids are safe and we keep our gyms clean and above these standards. These kids need that gym, the socialization, and the sense of normalcy. Open the doors. It can be done safely. There are many gyms in Maryland that will show you it is safe. We can control our environment. And finally, Maryland USA Gymnastics State Administrative Committee Chair Beth Renwick writes, I would like to say all of the owners and clubs in Maryland have worked together to create amazing safety, cleaning protocols, and procedures to keep all of the gymnasts as safe as possible, and they are working. Every other gym is open, even the other Parks and Rec programs. Every club is following Maryland state guidelines. We are completely virtual and with virtual meets in Maryland than the other states and our regions combined. We have been thoughtful and proactive. Most of the gymnasts wear their masks 100% of the time when they're in the gym, including the competing. The girls are comfortable with these protocols. With this, I will conclude, but please hear the plea of our petitioners to help get these girls back into the gym and have this organization continue to thrive for the sake of Harford County and for our children's futures. Thank you.
Thank you. Lacey Zankowitz.
Hello.
Good evening, ma'am. It's Council President Vincenti. May I have your name and address for the record, please?
Lacey Zankwitz, 2046 Knotty Pine Drive, Abingdon, Maryland.
Thank you, ma'am. Continue.
Good evening. I am a long-term resident of Harford County, and I am calling tonight in support of reopening ACPR Gymnastics in Churchville, Maryland. I have 3 gymnasts at ACPR. Josie is a level 5 competitive gymnast, Maggie a level 4 competitive gymnast, and Ruby a preteen gymnast. I have been a part of the program for 7 years. Currently, we are the only gymnastics facility closed in the entire state of Maryland. Even other parks and recreational gymnastics programs in other counties with higher positivity rates are open and operating safely throughout Maryland. During the time we were opened, we proved that we could operate and open safely. During the times we were open, July through mid-November, there were 0 positive COVID cases at ACPR Gymnastics. The coaches did a wonderful job of keeping the girls safe and the staff safe by following all CDC guidelines, including decreased practice sizes, mask wearing, social distancing, and proper sanitation protocols. Gymnastics is an individual, non-contact sport. This allows optimal social distancing during practice. The 2 gyms consist of approximately 20,000 square feet of space with no more than 40 people in the gym at one time. This means the air handling is quite large, and we also have the means to air out the facility. The reason given for closing was to ensure public safety. Youth sports were not where the rise of COVID cases were originating from, and to my knowledge, there were no cases of COVID caused by Churchville Parks and Recreation sports or activities as a whole. Gymnastics is a unique sport that cannot be easily moved or done outside of a specialized facility. Gymnastics require many hours, sometimes exceeding 20 hours per week, to stay in proper shape for the sport and also to prevent injuries. At this time, gymnasts are traveling to outside counties with higher positivity rates and driving an hour both ways for minimal practice time. This is putting added risk and stress on the girls, their families, and the facilities that are graciously opening their doors. Please reconsider and allow this facility to open so our girls can get back to the sport they love and continue to represent Harford County as they have done for the last 40 years. The mental health of the children is declining as we continue to deny them healthy outlets for learning, socialization, and putting their given talents into practice. With schools closed, it would be nice for the girls to have some sort of normalcy back in their lives, especially doing the sport that they have devoted so much of their childhood to. Thank you for your time and consideration.
Thank you, ma'am. Josh Kozel.
Hello?
Good evening, sir. It's Council President Vincenti. May I have your name and address for the record, please?
Yes, sir. This is Josh Kozel, 1106 Emerald Drive, Bel Air, Maryland.
Thank you, sir.
Thank you. And again, I wanted to thank the council for having a discussion and open conversation last week. This is something that is needed to continue. Maybe hosting a true town hall meeting with HBS could be a good next step. You know, I've said this once, and will continue to say it, that you do not oversee or make the decisions on every subject. You are an influencer, and that is what is, and this is what is happening in the county that you represent. I know that you cannot make schools or businesses open, but you can do a lot to support our county's liberty. For instance, during Glassman's latest budget review, he details that our county is fully funding the FY22 budget request from the school system. That includes $18+ million over the last year. Also, as noted, this makes up about 50% of the total funding for our school system. I would say that gives the council and Glassman a little bit of influence on what happens with our school systems locally and with our money that is being spent. Regarding the COVID data and painting the best picture for our community, this council is the Board of Health for our county. And I want to ask that more data is provided and used. Please don't act like the school superintendent and rely on other people to guide your thoughts and opinions. Don't mean that disrespectfully, just mean that as a community. There are outstanding data requests that have been, there are outstanding data requests that should be provided regarding comorbid conditions, death by age, nursing homes, and et cetera. If this has been provided, could it please be shared again? Other items that have been brought up and not been addressed are PCR visibility. FDA, WHO, and others have mentioned the notable risks of false results from the standard PCR test. It has been talked about how rapid tests are not reliable, but what about the case-demic we are experiencing and how much that this is a result of the PCR test results? Adding this with the past cycle threshold questions, what does our data really look like? Also, though not a deciding factor, it is a piece of the painting. But what is the cause, or what is the cause and the impact of case fatality rate continuously decreasing? At the height of in May, the CFT was over 5.5%. And it has dropped below 2% in November and continues to decline and will never reach 0%, just like the flu hasn't. Pair this with a consistent hospitalization rate, and we are starting to see the big picture. Lastly, what are the percentage of cases with versus without symptoms? Let's paint a picture instead of using the what if strokes that have been mentioned by some here in the past. Most important conversation that can be had amongst our county is the need for our children to be in school with their teachers, friends, and their school administration. Now more than ever, besides the loss of education, their mental health is in need of so much more. This cannot be a political decision. I ask that all the support possible from this group is needed and is appreciated. It is the start of taking up back our liberty. To all parents out there, I wanted to mention that we need to research, organize, and start to plan now. Yes, sir. We need to start to plan now because the county BOE elections are in 2022. And it is very clear that our children will need better leadership. Thank you, sir, and thank you, council.
Rachel Kozel.
Hello.
Good evening, ma'am. It's Council President Vincenti. May I have your name and address for the record, please?
Yes, sir. My name is Rachel Kozel. My address is 1106 Emerald Drive, Bel Air, Maryland.
Thank you.
Good evening, council members. My name is Rachel Kozel. My family has been in this county for generations. I would first like to commend President Vincenti and members of the council for hosting Dr. Bolson last week and having him answer questions that have been falling on deaf ears for the citizens
who have been participating in the BOE meetings. That being said, I implore you to continue your efforts in the matter of HCPS. Please keep the pressure on Dr. Bolson and the Harford County BOE to focus on reopening the schools, to develop and implement a plan to create a choice for parents and students that want to return to the classroom. We are now one of 6 states left in the United States without an in-person education option. Our children are falling behind their peers across the country. Our children are suffering. Their mental health is teetering on the brink of breaking. Private schools and daycares are thriving. Schools out of state are in person. Why are we not? Where is the plan to reopen our schools? Other counties in our state are laying out plans to reopen, at least in a hybrid model. It is imperative to the mental well-being of our children to do so. We cannot continue the way things are. I implore the county council members, keep insisting the BOE come up with a plan for our children and open the school. The BOE continues to follow state guidelines without a second thought. I'm imploring the county council to fight for our citizens, our children, and demand the BOE listen to and address its citizens, your citizens, that they are discounting. Push for forward thinking from Dr. Bolson above and beyond state guidelines he has been hiding behind. Compel him to review the 6-foot social distancing, 15-person threshold, and 5% metric. While these are helpful community guidelines, they are not helpful within the schools. Since later in the 2020 calendar year, even Dr. Fauci has promoted in-person learning in schools, stating that the data does not support widespread transmission in the schools. Our teachers are being vaccinated, and our children are in dire need of in-person learning. Please push to open our schools. Thank you.
Thank you, ma'am. Jill Ferrara.
Hello?
Good evening, ma'am. It's Council President Vincenti. May I have your name and address for the record?
Yes, Jill Farrar, 2000 Garden Drive. Tonight, I will be speaking on the importance of a second opinion. In 2009, my sister had a small stroke, and after many tests to determine the cause, she received the devastating diagnosis of moyamoya disease. This is a rare blood vessel disorder in which the carotid artery in the skull becomes blocked or narrowed, reducing blood flow to your brain, putting you at high risk of stroke, aneurysms, and seizures. My sister was advised by the diagnosing doctor to get several opinions for treatment, but unfortunately she did not take that advice because she thought she found a renowned neurosurgeon at Johns Hopkins. This doctor's opinion was that revascularization was only needed on the side of the brain that scans showed to be effective. But in my research, I found that surgery should be performed on both sides within 6 months of each other. I brought these concerns to her, but her response was, "It's Johns Hopkins. This is where people all over the world come for treatment. My doctor specializes in this and is an expert in his field." Well, that decision proved to be catastrophic for her and our family. At her 1-year post-surgery follow-up, she was told everything looked great, but only a few months later, she suffered a devastating stroke caused by an aneurysm. The sister I had known my whole life figuratively died that day, as she is now severely mentally and physically disabled. She can no longer take care of herself and requires 24 hours supervision and assistance. The reason for this story is because Harford County is continuously sharing a one-sided opinion. You have only focused on fear and the prevention of COVID, but not the harmful health effects of policies put in place that are supposedly to help us. Rather than staying in a COVID echo chamber, we all should be better served by consulting medical professionals with differing views. I believe this would result in a well-rounded approach that takes into consideration the overall public health picture, not just COVID numbers. We need public servants that will join over 40,000 medical practitioners and 13,000 public health and medical scientists who advocate focused protection efforts and stop participating in harmful lockdowns and school closures. Our schools need to be open. Our children are hurting. Also, today Hogan spoke about funding for the education. I'm asking our representatives to advocate that in order for the public school system to receive these funds, the schools fully open. If they don't, then that funding should go to parents and not the public school system. Based on the testimony tonight with the gymnastics, it is clear that this county is hurting our children and it needs to stop. Good night.
Good night. David Ferrera.
Hello, this is David.
Good evening, sir. It's Council President Vincenti. May I have your name and address for the record, please?
Sure, David Ferrara at 2000 Garden Drive. This testimony is going to be packed full of information. I hope everyone will pay attention. I viewed the 2020 annual report on the health department website this week. Surprisingly, in 2020, there were 3,032 death certificates issued. The average for the 3 years prior was 1,902 per year. That's a 37% increase in deaths during the period. You may be thinking, of course the numbers are much higher because of COVID. Well, that would be wrong, because there were 171 deaths with COVID in Harford County for the whole year. This leaves us with 927 excess deaths in 2020 over 2019. Those 927 deaths are over 500% more in comparison to those with a COVID diagnosis. Why the huge increase? Suicide, domestic abuse, not seeking life-saving medical treatment out of COVID fear, lack of preventative medical screenings, drug overdoses, who knows? In October, Harford Volunteer Fire and EMS VP William Duza testified before this council that cardiac arrests in the county have increased by 23%, seemingly due to victims waiting too long to seek medical help during the height of the COVID-19. He also testified that nationwide cardiac arrest survival rates have dropped significantly in 2020. The sheriff's office responded to 19 suicide attempts since October. 7 of those individuals regrettably completed their attempts. This is only from Harford County Sheriff's Office, not other agencies in the county. Do you really expect us to believe that the lockdowns and school closures are beneficial to the community? Why aren't these public health concerns being considered during the many COVID updates? And Mr. Vincetti, during a phone conversation, you told my wife that you are getting information that the public does not have. Is this that information? She is also still waiting on a response from the council on whether Harford County has a recovery plan when the state of emergency ends. We did hope that when Dr. Bashai was appointed as the new health officer, he would consider all aspects. But watching the last few weeks, he seems to have the same tunnel vision, focusing only on COVID without considering the devastating consequences these closures are causing to the community. I'm demanding a second opinion. Please take off the COVID blinders and begin to look at the great harm these policies cause. The county executive and the council should be pushing back against these failed policies on behalf of your constituents. By your silence and failure to act, you're endorsing them and you are participating in their detrimental effects. Anyone who could.
Melissa Hahn.
Hello?
Good evening, ma'am. It's Council President Vincenti. May I have your name and address for the record, please?
Yes, it's Melissa Hahn. The address is 211 Powellsville Road, Powellsville, Maryland, 21132.
Thank you, ma'am. Continue.
Good evening, members of the County Council. I'm writing as a parent concerned with the mental health of my children and so many children in our county, as witnessed by the 140 plus parents and students that attended our rally last week, as well as the 200 luminaries presenting the children that could not attend. I've witnessed my children, both an 11th grader and an 8th grader, struggling every single day on this virtual platform. They are not learning. They're struggling to stay afloat in a sinking ship, waking every day to the same frustration, anxiety, feeling of defeat and failure and isolation. My relationship with my children has never been worse. Every day I get up, make breakfast, and cheer them on for their day ahead and let them know if they need anything, I am here. The problem is the very mention of school is a subject these days that provokes feelings of anger, frustration, and reminds them of the very things that they are so desperately missing in their lives. Riding on the bus in the morning every day, chatting with friends, and exchanging stories of the sports and the fun things they did over the weekend or the night before, walking down the hallways, saying hi to friends and stopping to chat for a minute in between classes, eating lunch with friends and making plans after school for sports or activities, interacting with classmates and teachers, and learning. I never thought I would see the day when kids actually want to be in school. Not only do our children want to be in school, they need to be in school. They need social interaction. They need to be able to play high school sports, to be a part of a team, to learn that it's okay to lose as long as you did your best, and when they win, celebrating on the bus with the team on the way back to your school. Working so hard every day at practice to be the best that they can be. They need the coaches cheering them on and the teachers saying, great job. They need the pride of walking down the hallway in their jerseys and the camaraderie that goes along with being part of a team. They need parents in the stands being their number one fans cheering them on. The very things that make our kids who they are have been stripped away, and they continue to be stripped away daily. At first it was understandable, now it's unjustifiable and cruel. Being in school, yes, is about an education most importantly, and my children are failing. They're struggling every day with missing assignments mounting and the quarter coming to a close, yet another failing grade. No matter how much I encourage them or tell them that this is temporary and that they can do it, it's not enough. It's not school. It's not learning. Being in school is so important. Please do what other counties are doing. Do what is right for the children in this community. Give those that want our children in school the option before our children's self-esteem and growth as individuals has irreversible consequences. Every day that goes on is causing more and more damage than you know. Do what we elected you to do, and please represent the needs of the children and citizens in your district. Thank you.
Thank you, ma'am. Kim Novak?
Hello?
Good evening, ma'am. It's Council President Vincenti. May I have your name and address for the record, please?
Yes, it's Kim Novak in Jarrettsville, Maryland.
Thank you.
Continuing on. For months, your constituents have been voicing their opinions to reopen our county, our schools, our libraries, and our rec centers. And yet, no change. Hear the voices of the people and act. While I know you don't control it all, it's your duty to work for us and represent us. The comments tonight from Mr. Wagner in regards to the gymnastics, Harford County may own the buildings, but the citizens own the county. It's our tax money that pays for that, and you're taking our money and locking us out. The duty to reopen schools falls on Dr. Bolson and the school board. While Bolson answered your questions, he remained silent to the people. We are continuing to push him, but are asking you to use all of your resources to do the same. We have a public health crisis on our hands that is not COVID. It's the mental well-being of our children. How can decision makers ignore all the evidence that shows schools are not super spreaders? How are other states able to be open when they have a higher positivity rate than us? Did you know in the U.S. there's only 6 states that do not have in-person schools? Do you know Maryland's one of the 6? Dr. Savick stated the metric guidelines are recommendations, not requirements. I hope you do your own due diligence and listen to what she and her health officer is saying. Watch on YouTube on the Department of Ed's channel. Their board meeting posted on December 8th at the 11:40 a.m. mark. She presents actual numbers and plans from open school systems in Texas and 2 other states who have success being open. For the sake of our children, listen. In the very beginning of this crisis, very little was known about this virus. Almost a year on, we know so much, and we've accomplished the impossible, the creation of the fastest vaccine ever made in human history. In most of the U.S., children have already been back in school prior to the approval of this vaccine and have a sense of normality and a proper education.
why then, knowing what we know now, do we still have our county closed? Shutdowns don't work, and in fact are proven to do the exact opposite of the good they were supposed to do. When leaders decide what to close, why isn't only the things necessary to our children's well-being? You've got a good education too, right? Why are we denying them? As trite as it may sound, the children are our future. It's true. They are the future of this county, and right now we are watching it be destroyed. This isn't an issue only for parents. It affects every citizen in this county. One day, you're going to rely on these kids. Maybe they will be your doctor, or they'll take care of you in a nursing home. You want them to have a good education so they can properly take care of you, right? I'll end with this. On our public library's website, they advertise the Freedom to Read statement, which says, the freedom to speak, hear, and to read is protected by the First Amendment. It's the responsibility of the librarians, as guardians of the people's freedom to read, to contest encroachments upon that freedom. And any freedom by the government whenever it seeks to reduce or deny public access to public information. With a 99% survival rate of this virus, do you believe that the denial of our rights and freedoms is justified? Have a good night.
Thank you. Becky Malloy.
Hello.
Good evening, ma'am. It's Council President Vincenti. May I have your name and address for the record, please?
Yes, good evening. This is Becky Malloy. Address is 1723 Beach Bank Way, Bel Air.
Thank you, ma'am. Continue.
Yes, thank you for allowing me to speak this evening. I spoke last week as well. This week I don't have a planned and prepared and scripted speech. I'm just going to go by a few notes and just kind of speak from the heart. I'm a parent of a 10th grader at the Milton Wright High School, and I have watched his enthusiasm for school just dwindle down to almost nothing at this point. We're 10 months into this school shutdown. I'm begging you to put pressure on the Board of Education to get the schools open at the minimum to a hybrid level. I'm begging you to put pressure on them to review the metrics that they have been looking at since August 2020. Looking at other states and counties surrounding us, they are back to at least a hybrid model with numbers higher than us. At this point, we're never going to eradicate the virus, never going to go away. We have to learn how to live with it. The vaccines are now rolling out. I do have a question, that I would like to ask the health department myself is what's the age level for the vaccination? I understand it's 16 and under. They can't be vaccinated. I'm not sure if that's correct. But at the very least, we need a plan. Please, please, I'm begging you to put pressure on the board. I served on a parent-focused group 2 weeks ago for Hooker County Schools, and I have heard nothing back. Our children desperately need to be back in school. We need, at this point, and we deserve a choice, at the minimum, a hybrid model that can cater to, our teachers, that can cater to our parents. We need to get this done, and we need to get this done now, please. I thank you for your time.
Thank you, ma'am. Jeremy Novak.
Hello.
Good evening, sir. It's Council President Vincenti. May I have your name and address for the record, please?
Sure, it's Jeremy Novak, 4115 St. Clair Bridge Road, Jarrettsville.
Thank you, sir. Continue, please.
All right, I'd like to thank the council for being our voices and speaking to the necessary people and keeping the pressure up. You guys have been doing a good job of asking the tough questions, but we can't hold back. We need to keep up this pressure. The kids really need to get back in school. As you can tell, most of the phone calls that you've been receiving from the public have involved the children. Their mental health is very important. They're still developing. They're going to go ahead and be contributing adults to this county one day, and we really need to take their mental health into consideration. And obviously you heard from the parents calling about the gymnastics. That's just a small part of it. It's all about the kids. I'm sure you all have families. You want to get your kids back to school, get some normality back in their life. We just need to keep the pressure on the appropriate people. Touching on another subject, I emailed my councilman about another concern of mine that I had that I did not get to last week. The libraries really need to be open. It would be a great place for people to get away from a screen and look at a book, look up something that would interest them and take their minds off of the everyday virtual learning. The grocery stores are open. People are in and out of there 7 days a week. There's really no reason that libraries can't be open. I believe that we could get all the government buildings back open safely. They don't get nearly the amount of traffic as some of these places that have been open since the beginning. And also, I heard earlier, one of the councilmen talked about we need to give the facts to people. And I agree, everyone should get the facts. But what are we basing the facts on with these metrics? They're basing COVID cases on tests that are frankly not reliable. I lost an uncle a few months ago who had been dying of cancer for quite a while. And 2 days prior to him dying of cancer, he got tested positive for COVID. And wouldn't you know it, his death certificate listed the primary cause of death as COVID. Me and everyone else in the family know that that's not true. And I just believe that all these COVID deaths are creating fear and creating people to get tested more and more. So you're going to have a lot of false positives, and it's going to keep the numbers up. So if you could ask the health officials next time they're on what these metrics are based on, and is it realistic that we're going to get down to 5% to get schools back open? Because I really don't see it with the way that the percentages are being calculated. That's all I have. Have a good evening. Thank you.
Thank you, Mr. Novak, and we're sorry for your loss. Samantha Foster.
Hello.
Good evening, ma'am. It's Council President Vincenti. May I have your name and address
Sure.
for the record, please?
Samantha Foster, Havre de Grace.
Thank you, ma'am. Continue.
Okay, so before I start with my brief speech, I got a phone call a couple hours ago. Very confusing, but very gave some hope for the future. It was from the Boys and Girls Club from Harford County. The confusing part is that they are opening from 3 to 7 for after school care, going full force. So they said, hey, Lily, your third grader can come back and enjoy our after school program. Very confusing that our after school program that is run by Harford County is opening before school. So my child can go 5 days a week and go play with her friends. Obviously they're wearing masks and social distancing, but for 4 hours, 5 days a week, it's just very odd to me, but I'm very happy that my child will be able to have some normalcy and see people. But my speech, very simple. I want to ask you, gentlemen, tonight, who is Dr. Sean Bolson? Well, I will tell you. I've been doing some research as well as many other parents. He is a Washington, D.C. resident. He might have a BS address in Bel Air, but that is not where he lays his head at night. He also strongly believes in giving his 16-year-old daughter, Emily, a 5-day-a-week in-person education
at a very elite private school called St. John's College High School, located at 2607 Military Road, Washington, D.C. He allows his daughter, and this is, gotta love social media, he allows his daughter to engage in very large parties with her friends, not wearing masks or social distancing. Gotta love social media. So why are we putting our children's lives in the hands of a guy who would never allow this mental breakdown for his own child? He is giving his child everything, paying almost $30,000 a year for a private school that she can go to in their neighborhood. But here, he's driving from DC to Harford County to, pretend he lives here. And so this is a political sham, and every one of you councilmen need to start acting on this, or you're going to be held responsible. Thank you.
Thank you. Matt Freeland.
Hello.
Good evening, sir. It's Council President Vincenti. May I have your name and address for the record, please?
It's Matt Freeland, 1310 West Jarrettsville Road, Forest Hill.
Thank you, sir.
So I'm calling on behalf of ACPR. My 10-year-old daughter, Brooke, has been part of this ACPR gymnastics program since she was 3 years old. I asked tonight that you consider reopening our gym for the sake of the girls. With virtual school and no contact with their friends, they need their gym as an outlet physically, socially, and mentally. These girls put many hours a week into their sport, which is vital for them to keep up their strength and skills to stay safe while doing all that they do. When the gym reopened in the summer after a closing in the spring, the great staff at ACPR set forth protocols to keep everyone safe, and because of this, there was not one case of COVID during the entire time. I certainly understand the government putting restrictions in place to keep people safe, but research has shown that kids are not super spreaders. Because of that, the kids are safer at the gym than they are going into any store. I can also understand not wanting to open the facility to the rec programs, in which would bring many more children into the building. The competitive teams would just be a small number of kids and the coaching staff who are around each other anyway, as they still train in other gyms that we are renting space at. I'm not sure I see the goal in keeping this building closed when there are buildings all over the county that are open to support training and other sports that are indoors. My son's soccer club team is training indoors weekly and also playing in leagues indoors. A league of this type involves many more children interacting in a contact sport, in which my daughter is not doing at her gym. The children are spaced out and practicing social distancing. Continuing to keep this gym closed is hurting these children in a competitive sport, in which all of the other gyms in the state are open that they are competing against. They are getting normal training where our girls are limited to their time. Our girls are at a huge disadvantage with this lack of gym time. Please consider reopening the ACPR gymnastics program so that my daughter can get back to spending time with her second family, the wonderful coaches and teammates at ACPR. Thank you for your time.
Thank you, sir. Steve Cornelison.
Hello.
Good evening, sir. Council President Vincenti, may I have your name and address for the record, please?
My name is Steve Cornelison. I live at 1231 St. Francis Road in Bel Air, Maryland.
Thank you, sir. Please continue.
I've been a Harford County resident since 1982. I've been the coach at ACPR since 1983 and the managing director and head coach of ACPR Gymnastics for over 25 years. First, I want to thank all the county council and President Vincenti for the opportunity to speak on a topic that I feel really passionately about. The Churchville Recreation Center opened in 1992 and has been a great asset to the county and has allowed many thousands of Harford County youth to experience the great sport of gymnastics. We typically have over 700 to 800 participants in our program during a normal season and one of the largest team programs in the state of Maryland. Last year on March 13th, the governor of Maryland closed down many activities due to the COVID-19 pandemic. We were in the midst of our competition season at the time, and like all other gymnastics programs in the state of Maryland, the season ended there and we were closed until June the 30th. While we were closed, we pursued Zoom workouts, et cetera, and did what we could to help our athletes. Also, we had numerous rigorous discussions with gymnastics programs from all over the state and the country. We learned how we can safely reopen during the pandemic to keep our athletes, our parents, and our coaches safe. I submitted a detailed reopening plan to the county in June, which was accepted, and we opened up on June 30th for very limited practices. From that time until November 13th, we were successfully able to run our practices to keep our athletes and coaches and families safe from COVID. On November 12th, we were informed that we were to close immediately due to the COVID pandemic, so the doors were closed on the 13th. We remain closed to this day. No other gymnastics programs in Maryland were closed at that time. I do understand that the concern was during the holidays that there would be a great surge in COVID, but now the holidays are past, and the reality is that ACPR Gymnastics is the only program in the state of Maryland, gymnastics program, that is closed. This includes several very large parks and recreation programs in other counties, including, for instance, PG County. Further, there are many sports activities operating in Harford County that have not been closed, and private sports training centers are open for business. I'm here to request the county council that they consider safely reopening the Churchville Recreation Center, maybe in a limited way, like before. We have shown for many months that we can safely operate our program in a COVID environment, and we can again. Our program has not been a source of the spread of COVID in the county. Gymnastics is ideally suited to social distancing and sanitizing equipment, since our athletes train individually on the equipment. We have a uniquely controlled environment, and gymnastics is not a contact sport. Finally, right now, we have athletes training all over the state in different facilities and struggling to get a small fraction of the time of training they need in order to pursue their sport. We are going to Elkridge and to Timonium and Joppa and Shrewsbury to get a little bit of training when other programs can find a little bit of time to squeeze us into their schedule. It makes no sense for our athletes to commute to other counties where COVID rates may be higher when we have a perfectly good facility in Churchville sitting empty. I urge the county council to support the reopening of the Churchville Recreation Center, and I thank you for listening.
Thank you, sir. Stella Peters.
Hello?
Good evening, ma'am. It's Council President Vincenti. May I have your name and address for the record, please?
Stella Peters, 3713 Federal Lane.
Thank you, ma'am. Please continue.
Good evening. Tonight I will be speaking about reopening schools. I will be sharing a recent article from the Washington Examiner written by Andrew Mark Miller. A study of almost a dozen North Carolina school districts found an extremely limited rate of coronavirus transmission and no transmission from children to adults. The study, conducted over a 9-week period, tracked 100,000 people across 11 school districts and found that only 32 coronavirus cases were acquired at school, and none of those instances involved child to adult transmission. Over 9 weeks, 11 participating school districts had more than 90,000 students and staff attend school in person. Of these, there were 773 community-acquired SARS-CoV-2 infections documented by molecular testing. The study's abstract reads, through contact tracing, North Carolina Health Department staff determined an additional 32 infections were acquired within schools. No instances of child to adult transmission of SARS-CoV-2 were reported within schools. The study focused primarily on hybrid instruction, which combines in-person and remote learning, and this took place between August 15 and October 23rd. The study goes on to say that as community rates took off, Their plans and procedures were in place, and they towed the line. And the differences were really outstanding. In fact, the worse things get in the community, paradoxically, the greater the advantage to be in high compliance areas like school. Dr. Daniel Benjamin, a Duke School of Medicine professor of pediatrics and the lead author of this report, said about the results, crediting the school's adherence to social distance policies. Last year, a German study concluded that children do not play a major role in spreading the coronavirus in schools and may even serve as a brake on the disease. A study in Scotland published in September came to a similar conclusion and suggested that individuals who spent significant amounts of time around children were less likely to contract the coronavirus. Thank you, John Milano, for standing for our schools and our children. It's time to reopen our schools. Thank you, council members.
Thank you, ma'am. Ms. Dixon, do we have anyone else signed up?
We have no one else signed up, Mr. President.
Thank you. With no one else signed up, we will adjourn this meeting. Thank you.